This is an application video for the Surgicric 2 from VBM, a set for performing the classical surgical cricothyrotomy. The set is packed in a specific sterile pouch. The set consists of a safety scalpel number 11, 10 ml syringe, 6 mm cuff tracheal tube with dilator, neck tape, extension tubing, tracheal hook, blunt scissors, and speculum. Hyperextend the patient's head. Locate the cricothyroid membrane by the palpable depression between the thyroid and cricoid cartilage and fix this site with thumb and middle finger. Make a vertical incision with the safety scalpel. If the cricothyroid membrane is not identified after the vertical incision, then the soft tissue can be dissected bluntly using the scissors until the cricothyroid membrane is exposed. To keep the incision open, the tracheal hook can be used as additional aid if necessary. Make a horizontal incision into the cricothyroid membrane using the safety scalpel. Insert the closed speculum into the incision and advance it into the trachea. Turn the speculum by 90 degrees. Lift the closed speculum slightly in the caudal direction, then open the speculum. The tip of the speculum follows in the direction of the trachea. Insert the tracheal tube via the speculum into the trachea until the preset flange touches the speculum. Remove the speculum. Insert the tracheal tube deeper. The preset flange must be flush with the patient's neck. It is possible to check for the correct position by aspirating air with the syringe via the dilator. If the patient's anatomy requires it, the tracheal tube must be inserted deeper into the trachea after opening the flange. Then tighten the flange to prevent axial dislocation of the tracheal tube. Using the syringe, inflate the cuff to the minimum pressure required to seal the trachea, and check the cuff at regular intervals. Unlock and remove the dilator. Make sure that the position of the tracheal tube is not changed. Ventilate the patient. Verify correct placement and successful ventilation at regular intervals by a suitable method. Place the neck tape around the patient's neck and connect it firmly to the flange. Check the tracheal tube for a secure hold. Tracheal suctioning is possible through the connector of the extension tubing with a suction catheter similar or smaller, 16 French. Prior to extubation of the tracheal tube, deflate the cuff completely using a syringe, then remove the tracheal tube.